I am so happy for you all to come out tonight and kick off what is a weekend of events for us. Consider the Poor and HopeFest 2013 Elementary Education and Health Festival, where we get to work diligently at bringing together the healthcare community, the education community, and children in our communities that are struggling with health and education issues. Our charge and our challenge is to continue to educate, inform, and redirect behaviors. One, we all are well aware of the changes in our healthcare system and changes that will be coming online, and there'll be new individuals who will qualify for healthcare who would not have otherwise. But also we have the challenges of getting individuals to no longer use ER and use actual locations where there are clinics or healthcare providers who will meet their needs. And then there is the preventative measures that we want to begin to educate and begin to see incorporated in families where they can take better care, need less health services, and ultimately we wind up having a more vibrant community for all. We know that when the individuals wind up in ER, that is a cost that's passed on to us as taxpayers. But ultimately, we also know that it's not the proper place and the proper time for the kind of care that's needed for the issues that many of these in this particular demographic are winding up in hospitals and trying to get their needs met. So I want you to give a hearty applause for our recipients this year, our 2013 HopeFest Humanitarian Award, Marilyn Crumpton. This simply says, HopeFest 2013, Consider the Poor Humanitarian Award to Marilyn Crumpton for outstanding achievement and service of children and community, June 28th, 2013.
I feel like this is, that I'm the wrong person to be up here because there are a lot of folks that have made such wonderful things happen. And Kate Keller's here, and Mr. Schwab was here earlier from the Health Foundation, and they are the ones who really got me into this process and started thinking about how we could create a different model that would really reach into the population of kids who weren't getting health care and who weren't healthy, and it was interfering with school, and that because we were doing that, we could make a big difference. And I seem to have gotten more and more excited every year that we've been working on this. I started working, I think, 2006. And it has been such an awesome journey, and the rewards have just been amazing. How many families come and talk to us about what they have now they never had before? In Euler, when we were looking at the need for them, we found over 50% of the children had visible dental decay. And now, it is amazing that we're down already to about only 20% are showing any kind of decay, which is exciting. And our dental clinic is going to open there in August. And I don't know how many of you know Mr. Hockenberry, the principal there, but one of the things that he said was, yesterday morning I was over there checking on the dental clinic, which is in the middle of construction right now. And he came over and he said, I found 4 high schoolers, and they have never been to the dentist, and they're going to be at the front of the line. And that's the kind of enthusiasm in this community that I have found that is so exciting. And so our goal is to make sure that children don't go to the emergency room unless they need to, and that they have a good, reasonable, quick alternative that keeps them out of the emergency room. And they're just, every day there are more and more people who seems like have stepped alongside of us and gotten excited. And it's a part of this model that's called a community learning center. And I don't know if y'all are familiar with that term, but it's an awesome way in which the community wraps its arms around the school, and the school opens up its doors, and then magical things happen. And that's what we've seen in the Vision Center. We served over 1,000 children in the very first year that we were there, and we're really excited about that. We counted, and just from the health department clinics, we saw almost 9,000 children in our school-based health centers that maybe would have gone to the emergency room instead. So we really feel like that what we're doing is making a difference. I was in Washington this week and had the chance to talk a little bit about what we're doing. And what I told the people that were listening to our story was that Cincinnati is an amazing place because it is so community minded. And I think it's just a ripe opportunity for making a difference for children, to make sure that every child has an opportunity to learn unimpaired by health problems, and that we're going to lick this obesity problem in our community. And we're going to start with our youngest kids, and we already have started pretty far down that path. So thank y'all so much for the recognition, not from me, but from Ms. Ronan, for the work that she's done to let us be in Cincinnati Public Schools, Dr. Maseru, who is the health commissioner who I work for, and for the Health Foundation for the tremendous support, not just in funding, but very much more in standing alongside of us, teaching us how to do a business model so that we can create self-sustaining services that will really stretch our health dollars in this community. So thank you for this recognition on behalf of everybody I work with.
There's so much more work to do, not just tomorrow with tomorrow's event, but the information that we'll compile as we are collecting data tomorrow as well, and we'll take it back. Children's has been phenomenal at leading the way of looking at how can we look into the preventative side of things and be proactive with measures that will allow us to continue to get to the demographic that finds it difficult to find their way to us unless there is an emergency. And so getting into the schools is just one of those avenues. Having an event like this tomorrow is one of those avenues. And we'll continue to research, we'll continue to find monies to continue to be proactive, especially with the challenges that are coming online, and making sure that individuals are aware of what services are available to them. And so I'm honored to be able to give this award to Maryland. We're honored to be able to put on this event and have so many of you supporting us to bring this kind of endeavor to pass. And we'll continue to work hard as we continue to reach out to those who are less fortunate in our communities. Again, we thank you so much for coming out. We look forward to doing more service in the future. Thank you. God bless.